Well, thanks for staying with us on Morning Live. Now, as the lockdown due to COVID-19 restricted access to services worldwide, people with albinism in particular have really struggled to access healthcare facilities for skin cancer and visual impairments. And September is, of course, Albinism Awareness Month. And although many countries have eased restrictions, Amnesty International says that human rights violations and exclusions from government aid still exist for people with albinism in Southern Africa. To discuss this further, we're joined by Nomasonto Mazibuko, who is the National Commissioner at the Commission for Gender Equality. Thank you so much and welcome to Morning Live. Well, Ms. Mazibuko, I cannot quite hear you at this stage. Let's just try that again. Good morning.
Good morning, Sakina, and good morning to the viewers. Is that better?
Much better. Thank you so much for speaking to us. Now, Ms. Mazibuko, a very important point that we are focusing on this morning, and inclusion and equality for people with albinism. It's always been a personal passion for you and professionally too. But with the coronavirus pandemic, how would you describe inclusion and equality as experienced by people with albinism right now?
Let me start off by saying inclusion and equality in Southern Africa is a problem to normally pigmented people. It's worse with people with albinism, because if, as a gender commissioner, equality is what we're striving for. And equality, you find that most of the people with albinism are bullied by their own parents, where they fight. The father will say, it's because of you that I've got this child with albinism. And you find that now with COVID-19, we're all seated at home, and it became worse with our neighbors, where we find that most of the people were speaking to say it is because of this child who is a curse that God has punished you. And we were bullied. You find that social media is key. You find all the people were bullying even children social media. But I'm happy to say young people with albinism have projected themselves positively on social media, on Facebook, on Instagram, where they put themselves there to say, though we are not included, but they have tried by all means to include themselves. When it comes to healthcare, we are all told that COVID is rife, you can't move. So it means we didn't get our medication, we didn't get our sunscreens, we didn't get anything. But it is up to level 3 that we tried to get our dignity pack, where we were distributing it. But let me tell you, inequality was worse, because as an organization, we were funded by social development, but we have since lost that funding. So we are back to square one. The inequality, we're not included. Schools are going to be opened. What about the children that are going to boarding school? Because our parents take us to boarding school, and our parents feel we are better off at school than sitting here at home. So inclusion and inequality is our way of life.
Ms. Mazibuko, you know, listening to you, I must admit that I'm equally shocked and also embarrassed for myself that I haven't really paid keen attention to this plight, and just listening to you relaying what people living with albinism have to make through, it really is a blot on our collective society that people with albinism have to go through this. Amnesty International makes particular reference to Southern Africa as a region. So how is the situation here in South Africa in particular and in neighboring Southern African countries at the moment?
Sakina, one, we're not living with albinism. We are people with albinism. We are born as people with albinism. We have not acquired. So we don't live with albinism. Two, I must say we put our heads off, and we thank Amnesty International, because that is the other organization that has assisted us as the Albinism Society and the task team on albinism, that when we had the independent expert who was visiting South Africa, when she was supposed to go and table her report in Geneva, Amnesty International funded us with Dr. Tabete, who is the chair of the task team. And we thank Amnesty International because we're working very closely with them. But in South Africa, coming back to home, we are still marginalized. We are busy working on a action plan on albinism. Government is quiet. Government says they have had the independent expert, but we are struggling to sit with stakeholders, including government, to come and assist us to get an action plan on albinism in South Africa. And more so, we had hoped as persons with albinism that the president is chairing the AU, we would get the chance. Sakina, bear in mind, we are killed for our body parts. And as we're chairing, we thought the president will give us a hearing so that when we go to AU, we table our issues. And when South Africa sneezes, the whole of Africa catches a cold. So we expected that we will go together before we lose our seat, before we complete our seat, that we will say to Africa, please stop killing people with albinism. Our body parts don't give luck to anybody.
And as an activist, Ms. Mazibuko, what kind of interaction did you manage to continue having with people with albinism in your line of work since the lockdown started?
What I've done is that we, as the Albinism Society of South Africa and the Department of Social Development in Gauteng, we've got a dignity pack. In this dignity pack, we have a sunscreen, aqueous cream, toiletries that we distribute. I must say, through the people who are working with Albinism South Africa, we have coordinators in the whole of Gauteng, in Tshwane, in Mogale City, in Sidibeng, in Johannesburg. So we have distributed those dignity packs, and our people are receiving those dignity packs every month. And we have ventured with the food bank where our people have received food parcels. It's not enough because, as you know, we have seen, Sakina, that everybody is fighting for the food parcels, and the grant has not been distributed. Remember, Sakina, you were just saying in the morning that South Africa has no color, govt has no color. 27% of unemployment. It will go to 50%. Then the people with albinism will be still taken further backwards because we cannot compete with anybody. And people in the workplace still don't give reasonable accommodation. The people at the workplace still don't understand that albinism is a disability. So we have to be working very harder. And as an activist, I can't keep my mouth shut. I can't do anything because I'm pushing very hard to say, as I pass the generation equality, am I giving my baton to the right person? Am I done enough work to sensitize the young people with albinism that you have to fight, you have to be doing everything, because disability in this country has been a wheelchair and a white cane.
I will say once again, Ms. Mazibuko, I am personally ashamed at my own ignorance in this regard. But just looking at some of the challenges still faced by people with albinism today, we know, as you also pointed out, about killings. And are those raised as pointedly and prominently as they should be here in South Africa? And many people obviously have the perception that maybe it's not such a big problem here, perhaps elsewhere on the continent more so than here in South Africa. But what is the real lie of the land with regard to people getting killed for their body parts today?
Sakina, remember, we were tempted to say people with albinism don't die, they disappear. Now, in the 20th century, it is proven that people with albinism do die, but they die brutally by being killed for their body parts. What we're doing now, as the organization on albinism, we are working very hard to say to parents, love your joy of bundle. Talk to your child. Your child should be safe wherever. Your child must not be away from you for an hour and not look up, around. Our cases in South Africa are not reported. Why are the cases not reported? Because we are ridiculed when you come to the police station to say, I've just missed my child for 10 hours. I don't know where he is. But they say, no, mommy, that child has disappeared. As you know, that people with albinism disappear. But in 2017, when the minister, Fikile Mbalula, was Minister of Police, he put across a 6-point plan to educate police. And that 6-point plan, still, you go to any police station after this interview, Sakina, it's not displayed. Policemen and policewomen are not sensitized about the 6-point plan. So what we're doing is that our body parts are not going to be sold because we are working very closely with the traditional healers in South Africa. And I must comment that and thank the traditional leaders, healers that are saying, not in their name, because when you come to a Indumba of a Sangoma or a traditional healer, you cannot have the body parts of people with albinism in your practice. So the issue of people with albinism being killed, it needs us people with albinism ourselves to be very active. That is why I'm saying through COVID, we'll find our young people going through Facebook and trying very hard to project and tell people that we are proud and we are standing strong to be counted as persons with albinism.
So you also mentioned, Ms. Mazibuko, that in the workplace, for example, albinism is not seen as a disability. And I'm just looking at the insert that we're currently playing on screen about a learner in school. And again, just highlighting the disability of people with albinism and the limitations that comes with it when children have to go to school. So you talk about the police and a 6-point plan that was introduced. What about the education center and bringing back the issue of inclusion once again?
Sakina, inclusion, South Africa says they do inclusive education, but most of the people with albinism are visually impaired. And our equity is not the same. Most of our children are taken to the school of the blind or to special schools. There, we find that still the Department of Education has not done enough to educate even the educators about our condition. And the Department of Education itself has not done enough. The waiting list of getting children into school still exists. And we have worked with the Department of Education to say any person with albinism needs 30 minutes to each every hour so that they have one large print in their examination papers, in their documents, and then they must be given 30 minutes to 45 minutes for every hour when they write the examinations. So the special concessions still lies with the Department of Education. But we have worked together with Blind SA, where we're saying to government, please look after the children who are blind and visually impaired. Last week we launched as visually impaired and blind women, where we say when you go to the police station having been raped, the police still wants to ask you a question. What was that man wearing? So education is very broad. we start by educating our parents, educate our extended families, educate the larger community, and educate each and every department of government.
I'm listening to you, and I can't but think that how inadequate broader society has been in our response to your plight. Now, September is, of course, Albinism Awareness Month, and it cannot be that we only revisit this in September. So what would you like to see? What is the one thing that you want the public to be aware of, firstly? And secondly, what can we do, for example, as a public broadcaster? How can we better come to your assistance and aid to make sure that there's greater awareness?
One, thank you very much, Sakina. We're battling that we will only be spoken to in September. But let me go back to June, which is a youth month in South Africa. But the United Nations has declared June 13 the Albinism Day worldwide. So South Africa is still going to have to celebrate our youth with albinism during the month of September. And we would like us as South Africans to share, mainstream us, know that we are people. We are not your stepchildren. We are not going to vanish, as you think, to another colony. But we would like more broadcasting programs to be done, as it is Heritage Month. Let's talk about heritage. What happens? Where did the people with albinism come from? What is our history? And we would like to be included in your programs. Two, we would like our persons with albinism to be employed. It's better when you are interviewed by a person with albinism, himself or herself will understand my plight as a person with albinism. Yes, Sakina, we have worked so many times with you, but it only dawns when non-Zuzo will say, by the way, it's September, how can we work? And employment, we would like people to employ people with albinism. Educators to give extra time and extra caution to children with albinism. We would like to say our parents, love us. Don't feel that getting a child with albinism is a curse. We'd like to say to our men, please don't want to prove that the person with albinism has feelings. You can marry me and be your wife, and you can have a person with albinism in your family. We're saying to the women out there, accept us to be your son-in-laws and daughter-in-laws. It goes across, Sakina. I can take the whole day to say, let's go into this realm. You find a person with albinism. As I speak to you, and as South Africa is listening, a child with albinism is born in each and every family. And why? I'm happy that in my old age, I've worked so hard that you see each and every corner. When you go to each and every mall, you will see a child or a person with albinism who walks with confidence because of the Albinism Society, which I founded in 1992.
Ms. Nomasonto Mazibuko, noted, ma'am. We certainly have to keep this conversation going. We certainly need to expand on the awareness campaigns. But thank you so much for your time. Nomasonto Mazibuko from the Commission for Gender Equality, talking to us about the impact of COVID-19 on inclusion and equality for people with albinism, and this in light of Albinism Awareness Month.